reason we want to pass this legislation is to improve and enhance the care of patients in the state of Washington.
I want to serve patients in Washington the same way that I was serving patients in Oregon.
We need to be able to practice to the level that we've been taught, and I do believe that patients need the access to care.
The Department of Health has recently reviewed our request for increasing the scope of optometry here in Washington, and overall they have agreed that this would be a good thing for all the citizens in Washington.
One of my big concerns with our current scope of practice is that relative to other states, we're behind.
Scope of practice is a really big consideration when it comes to me and also a lot of my other classmates.
I would hate to have to make the choice between living somewhere where I can practice to the fullest of my knowledge and skills or living in Washington.
Washington is clearly in the bottom third to bottom quarter of our ability to practice to our level of education.
Professionally, it was challenging to take a position in Washington knowing that I would have to, in some ways, take a step backwards in the way that I was practicing.
Up in Alaska, I'm actually able to perform pretty much every single procedure that is taught at the colleges of optometry. But down here, I'm unable to do any of those procedures.
And it feels kind of strange that I can go across the river and do a lot more procedures than I can here on this side of the river.
I had a patient a few months ago, a young man, who had a little cyst on his eye, and it is a very minor procedure to get rid of that. It's incredibly easy. But in Washington, I'm unable to help him with that. And I said, you know what? Just come to see me next Wednesday when I'm in Forest Grove. And so I actually referred him from myself to myself in Oregon.
It will allow them to get the care with me on the day that they see me instead of having to travel 2 or 3 hours.
To have to drive 100 miles to see a professional when we are completely capable of providing these services, it just doesn't make practical sense.
A lot of people are in pain, they're in need, other clinics are booked full, they can't get in somewhere else, and so just for continuity and access of care, I think it's just really important that we consider being able to practice to the extent that we're taught.
When I'm having to refer patients out to certain specialists for certain procedures, some of these, with all the impacts of today's climate with COVID, are pushed out even further.
So no, you have to have a referral. That means a different day, a different place, different copay.
It's usually the patients that need us the most that struggle with gas and childcare and all of those things that we don't always think about.
If they don't trust or know anything about that provider, then they will certainly not access the care that they need.
We're facing a healthcare provider shortage, and one of the biggest shortages that's coming is specifically going to be ophthalmology.
Doctors that are coming out of school right now, they're hesitant to come to this state because of our antiquated scope of practice.
I really hope that I can practice here to the fullest of my knowledge and the skills and capabilities that I am learning in optometry school.
Let our patients have access to high quality, affordable health care where they live.